Hello, everyone. I hope you're all staying safe during this time. My name is Annamaria George. I'm a high school student from New Jersey, and I'm going to speak about seasonal allergies in order to help you prepare for the allergy season. So let's break down the sound of a chew. Seasonal allergies, which are also called allergic rhinitis or hay fever, is something we have all seen and for some dread. That achoo? It's a sound we hear most when spring rolls in. Allergies are a series of reactions to a foreign substance in the body. These substances include pollen and mold spores, and these particles are usually found in the air since they fertilize other plants. The symptoms of allergies are incredibly irritating and annoying. They include coughing, sneezing, runny nose, itchy throat or sinuses, tearing, itchy or red eyes, also known as allergic conjunctivitis, tightness of chest, postnasal drip, which happens when excessive mucus is produced and drips down from the nose to the throat, headaches, wheezing or shortness of breath, congested ears, and nosebleeds. Excessive sneezing or nose blowing due to mucus and congestion can damage nasal tissue and then rupture the blood vessels, and this results in nosebleeds. The allergens that cause certain seasonal allergies are commonly found during certain seasons of the year, hence why it is called seasonal allergies. The allergy season usually occurs between spring to early fall. From February to May, the trees emit the most pollen. From May to June, high pollen levels are found in grass. And finally, from August to October, the pollen is let out most from weed. For most people with seasonal allergies, their allergies exacerbate during the summer and then simmer down during winter due to lower pollen counts and cold temperatures. In spring, the rain showers and wind break apart pollens and release the particles into the atmosphere. Allergies are very common, as it is the sixth leading cause of chronic illness. About 20 million American adults and 6.1 million children suffer from it. On the worldwide scale, it affects between 10 to 30% of the population. According to the chart, the cities that line up the west coast of the United States face lower levels of pollen, and they have shorter allergy seasons. The states in the mid-Atlantic and southern regions have heavier and more severe pollen counts, and many people consider this factor before moving to another city. Risk factors. There are some risk factors that come with allergies. It often runs in the family, usually passing from parent to children. For example, my father has severe allergies with symptoms such as itching in the ears, and that passed down to my brother and I, who in addition to that have itchy eyes, excessive sneezing, and frequent nosebleeds. Allergies can be a trigger for asthma and shortness in breath. About 60% of asthma patients have allergic asthma, which means that they had allergies first. Allergies also often develop in the childhood first. Many children grow with the difficulty of dealing with allergies. However, they can outgrow the allergies, and it can stop and come back later on. About 100 genes are associated with allergies, and a few are associated with asthma and eczema. All it takes is one or two of these genes to code for the development of an immune system response to certain allergens as the body grows and develops. For example, a gene that is connected to this is NFAT-C2. This gene codes for a protein that joins the nucleus to make an active receptor for T cell stimulation. In other words, NFAT-C2 prepares the T cells to be activated during the body's immune response, which is initiated when the body comes into contact with an allergen. Allergy testing. If you experience certain symptoms that are consistent with allergy symptoms, please see a doctor to get an allergy test to identify what causes your body to initiate an immune response. If your allergies are getting worse, then first distinguish which particular allergens cause you to react this way. First, there are the skin tests, which include the scratch, intradermal, and patch tests. The scratch test involves an allergen placed in a liquid, which is then placed on a section of the skin marked by numbers. The specialist will scratch the skin surface to allow the liquid to come into contact with it and will observe it after 20 to 30 minutes. If the area shows redness or itchiness, then it concludes that the person is allergic to that substance. The intradermal test is similar to the scratch test, but the allergen is injected to the dermis, which is a deeper layer of the skin. The patch test is slightly different. The allergy specialist will use adhesive patches and stick them onto the skin. The patches will be stored with the allergen inside. This form of the test is more effective as the pads will stick there for a long time. This allows the specialist to see how a body reacts to an allergen after long exposure. Testing occurs from 72 to 96-hour intervals. Besides the skin test, doctors can also order a blood test to search for specific antibodies that interact with specific allergens. Immunocap is a blood test that detects IgE antibodies. There are steps you can take to control and treat the allergies. Step 1. Monitor. Check the television, newspaper, radio, or internet for pollen levels and forecasts. If there are high levels of pollination, take precautions by taking medication before getting exposed to pollen. Close doors and windows during these times. And the early morning is when pollen is most high, so avoid going outside at that time. Step 2. Reduce exposure. Stay indoors on dry and windy days. Go outside after rain since the water will clear up the pollen in the air. If you are doing outdoor chores such as lawn mowing or weed pulling, wear a dust mask. Wash clothes worn outside and shower to rinse pollen away from the skin and the hair. Step 3. Clean the air. Each time we open a door, air comes in, which means particles of pollen rush in too. You can take precautions to cleanse this air. You can use the AC indoors. The AC filters certain air particles and balances the humidity of the home. You can also use filters to cleanse the air that enters the house. HEPA, or high efficiency particulate air filter, is a filter that takes out the allergens from the air that goes through it, resulting in a better quality of air indoors. The HEPA filter is used in vacuum bags to filter out any allergens that come through the opening of the appliance. Also, keep the indoor air dry with a dehumidifier if you have a mold allergy or if you live in the basement. It takes the moisture out of the air, which prevents mold growth. For people with seasonal allergies, however, sleeping with a dehumidifier helps to prevent nosebleeds. Step 4. OTC or over-the-counter medication. Oral antihistamines help relieve sneezing, itching, runny nose, and watery eyes. Brand names include Claritin, Zyrtec, and Allegra. Decongestants provide temporary relief from nasal stuffiness. However, too much of these oral medications can also worsen symptoms, and brand names include Sudafed and Afrin. Nasal sprays ease allergy symptoms, but they're also most effective when used before the symptoms start. And combination medicines are allergy relief that is composed of an antihistamine and a decongestant. Brand names include Claritin D and Allegra D. In case medication does not work effectively for you, you can also explore different alternative methods. Acupuncture is a practice that consists of thread-like needles stimulating points within the body to release chemicals to the central nervous system. It is believed to promote well-being and help relieve allergy symptoms. On its own, acupuncture may not be an effective treatment. However, a German study did find that using acupuncture can reduce the use of antihistamines and relieve symptoms. They found that acupuncture did this by regulating the pro-inflammatory antibodies such as IgE, IL-1 beta, and TNF alpha. Neti pot is an object with a molded spout. One fills it with the water and saline mixture and pours the solution into one nostril by placing in the spout. What happens is the solution runs from one nostril through the nasal passages and exits the other nostril. The saline solution loosens mucus that is congested there and rinses the sinuses. This provides quick allergy relief as it helps with nasal allergy symptoms. In addition, it is quick, easy, and cheap to use. Coconut oil. Many people prefer to use coconut oil to reduce allergy symptoms because OTC medication can have certain side effects. Coconut oil has a high content of lauric acid. Lauric acid is the fat that contains antifungal, antibacterial, antiviral, and anti-inflammatory properties. This can ease allergy symptoms and boost the immune system. NAET, or Nambuthriprad's allergy elimination techniques, are drug-free and organic solutions to alleviate allergy symptoms. They were founded by Dr. Devi Nambuthripad. Patients see relief because NAET certified professionals use different disciplines of medicine to train the body to resist initiating an allergy response against allergens. The effects can help patients come into contact with allergens without experiencing fatal effects. Probiotics. There was a study that probiotic therapy was effective in relieving certain allergy symptoms. There's a specific probiotic strain called lactobacillus. In a couple of studies, taking lactobacillus through the mouth orally or in yogurt form reduces allergy symptoms by regulating immune markers from white blood cells. However, many more studies need to be completed before the efficiency of probiotics can be assured. Rotation diet is a diet where one changes the dishes they eat every day for 4 days. The diet helps to prevent food intolerances from developing. When we eat the same thing for days at a time, the immune system reacts to it and can eventually develop intolerances and increase inflammation. Also, eating different meals every day allows for nutrient diversity, as you can get different substances from them. Since many people do not find probiotic therapy as effective, some consider fecal transplant. The antibodies of the receiver could be changed with the intake of stool pills made from the donor. The donor would not have the antibodies the receiver would have in regards to initiating that specific immune response. After completely wiping away any traces of the allergens from the stool sample, the specialist will then restart the immune system by replacing the antibodies with the donors. Immunotherapy. For some allergens, you can train your body to react in a less severe manner. This process is called immune therapy. Immunotherapy is a preventative treatment in which the subject gives themselves gradually increasing doses of the allergen to become immune in the long term. This is because this practice produces a blocking antibody, which reduces the symptoms of allergy when the body comes into contact with the allergen next time. After identifying the target allergens, the allergy specialist will make sure the person is really sensitive to the allergy before moving on to this step. Allergy shots are a form of immunotherapy called subcutaneous immunotherapy or SCIT. It is the most commonly used treatment. The most unique thing about SCIT is that it actually changes the immune system to prevent an allergic reaction from taking place, and stays that way for a long time. It has been around for more than 100 years. Basically, SCIT involves injecting an extract of the allergen into the skin, specifically the subcutaneous layer, which is the deepest layer. The shots are typically given once a week for 7 months and then twice a week after, the therapy lasting a total of over 3 years. Taking these shots can take a lot out of you, including the risk of anaphylactic shocks. SLIT is another form, in which tablets or drops are used instead of injections. They are placed under the tongue for 1 to 2 minutes before the subject must swallow. Typical timeline is about 3 to 5 years. The tablets are only approved by the FDA for ragweed and dust mites in the United States. According to the Allergy, Asthma, and Clinical Immunology, evidence is emerging that SLIT may be effective for treating the red, itchy eyes caused by pollen during hay fever season. In addition, it might prove an effective therapy for children with mild eczema. Another version are allergy drops. They are not approved by the FDA in the US and is off-label, but they are widely used in Europe and Canada. Hay fever or COVID-19? It is important that with the pandemic raging on, that you can distinguish your symptoms between the above illnesses. Allergies have many similarities with COVID-19, and if you see certain symptoms, make sure they align with the chart above. Please get tested for COVID-19 and stay indoors if the symptoms align more with the expression of COVID. Unlike allergies, COVID-19 has nausea, diarrhea, fever, body aches, and chills. Please see a doctor if you have any more questions or wish to seek treatment. Allergies can be extremely irritating to deal with, and treatment can be costly. However, it is something that many of us deal with, and taking proper preventative measures and learning accurate information can help out a lot. Here are my references. Please feel free to visit these websites for more information on seasonal allergies. Thank you everyone for taking the time out of your day to watch my presentation. I hope the next time you sneeze, you will think about your treatment options to get rid of the annoying symptoms that follow you around during allergy season. Please stay safe, happy, healthy, and have an amazing and blessed day.